I needed it to be something other than, bunnies and butterflies is the example that I use. I needed it to be substantial. And so I began to do my research, and I began to look at these nature-based solutions in relation to patient care in a way that supported the patient through their journey, but in a structured way to help really support their mental health as well as their physical well-being. And what I found was a number of outdoor nature-based activities that were effective, again, in supporting the mental health. Even with cancer survivors who many times have pre-existing mental health conditions, it was still an effective outlet for me. I found that studies were showing that ideally 20 to 90 minutes over the course of 8 to 12 weeks had the most impact. And I found that even things like backyard gardening, or what I call windowsill gardening, the activity of engaging with the soil and the planting and the nurturing had an impact. Story. My sister Catherine died of metastatic breast cancer 7 years ago. She was actually very instrumental in my coming to this path with such curiosity and ferociousness. She absolutely loved nature, and she would tell me towards the end, it's time for me to go to hospice. Take me to a place where I can be near nature. And I thought to myself, okay, I need to find end of life in a nature-based environment. How am I going to do this? But I did find, by the grace of God, I found a hospice that had an atrium. And the healthcare providers would wheel the patients down to the atrium, and they would just sit there quiet. And this was perhaps one of the most, beyond the pain medication, beyond the visitors, beyond anything else that was, happening at that time, that was probably one of the single most effective ways of bringing her peace, being wheeled to that atrium. This can happen. I know, because I've had colleagues share with me studies that they've been involved in Canada, and again in the UK, where they've looked at how does that accessibility at different stages look like, and how can we transform those barriers